Hi guys, we're here with a special guest. You all remember my mom, the Doctor Maker, aka Judy, and she is the person I had mentioned in my other videos who had a DVT. So Mom, tell us what happened.
Well, I'm going to have some oral surgery, but because I take a blood thinner, I had to be off of that for several days. And the day after I got off of it, I started having blood clots in my armpit and then down a couple of different things there, which was not a good thing.
Which you're not supposed to do if you haven't ever had a blood clot before, but she's always been an overachiever, so what did we expect? So she got to go back on her blood thinners until the clot resolved. Now she's getting ready to have her rescheduled procedure, but her cardiologist and I decided that she probably needed to be bridged with Lovenox, as discussed in one of my previous videos, because she needs to be on some sort of blood thinner that doesn't have a super long half-life. So we are going to show you how to dose Lovenox.
Ow.
As with any other blood thinner, the main side effect or risk with Lovenox or low molecular weight heparin is bleeding. Mom, have you had any problems with bleeding on this shot?
No, I haven't. I think I have been fairly unbleeding.
Good. As the person giving the shots, I can attest that you have had a bit of bruising around the injection site. Have you had any discomfort?
It pinched like a little pinch when you give me the shot, but it's not bad. I understand that you're supposed to be able, if you wish, to give it to yourself, but that's a little bit bigger needle than I like. I was a little squeamish, so I chose to have my doctor do it.
Happy to do it for you. All right, well, without further ado, I say let's get to shooting.
Okay, sounds good.
Before we do the shot, we want to make sure that you clean the area with an alcohol swab. And if I were in an office situation, I would be wearing gloves. I happen to know that my mother does not have any communicable diseases, so we're just gonna give the shot. You can see she's got some bruising here from her previous injections. So I'm going to dial this down to her dose, which is 0.7. And then you want to grab some skin.
I got plenty of skin.
And inject. And then when you push it down, I like to rub it in too. They say it doesn't make it hurt as much that way. And then
I hardly felt it.
We're off to the races.
I shall not bleed.
And
unduly.
you're having your procedure tomorrow, so this should be your last injection, and then you can go on your regular blood thinner after the procedure is over.
Yes, thank you.
You're welcome.